Welcome to Everyday Nursing Knowledge Lectures, and today we will learn types of insulin. Insulin is a hormone that is produced by the beta cells of pancreas, and it is secreted directly into the bloodstream, and it helps to regulate body's blood glucose. It helps to move blood glucose into the cells. So patients with diabetes, administration of insulin helps to regulate the blood glucose. Until 1980, animal insulin, that is insulin derived from the pancreas of cows and pigs, was the only treatment for insulin-dependent diabetes. But now it has been replaced by human insulin and human analog. What is the difference between human insulin and human analog? Both are lab-made. Human insulin are the exact copy of the insulin found in human body. They are meant to replicate the insulin found in human body, whereas analog are genetically modified. That means they change the structure of the insulin. Insulin is made up of amino acids. So they change the structure of the amino acid so they can change how fast or slow they act. Example of human insulin is regular insulin or NPH insulin. Example for human analogs are aspart, lispro, glulysin, levemir, and detamir. Now let's see the types of insulin. Insulin are classified by their onset, peak, and duration of action. Onset is how fast they act, peak is when they get their maximum effect, and duration how long they act. In the United States, insulin has a concentration of 100 units per ml. Now insulin is divided into rapid acting, short acting, intermediate acting, and long acting. Rapid and long acting, they are insulin analogs, whereas short acting and intermediate acting are human insulin. Example for rapid acting is insulin aspart, and the brand name is Novolog, insulin lispro, brand name of Humalog, and insulin glulysin. Example of short acting is regular insulin with the brand name of Humulin R or Novolin R. Example of intermediate insulin is NPH or isophane with the brand name of Humulin H or Novolin H. Example of long-acting insulin is detamir or levemir, glargine or lantus. Now let's see their onset, peak, and duration of action. The lispro, aspart, or glulysin, which is rapid-acting insulin, their onset of action is less than 15 minutes. So it is usually taken just before a meal. It peaks between 1 to 2 hours, and their action lasts up to 4 to 6 hours. Now the short-acting example, the regular insulin, the onset of action is half to 1 hour. So it is usually taken 30 to 60 minutes before a meal, and it peaks between 2 to 4 hours with the duration of action is 6 to 8 hours. The NPH, which is the intermediate insulin, the onset of action is 1 to 2 hours with a peak effect of 6 to 10 hours, and it lasts up to 12 plus hours. So it covers insulin requirements for half a day or overnight. Now the long acting, which is detamir or glargine, the onset of action is within an hour. It has a flat effect or no peak effect. The detamir lasts up to 12 to 24 hours, and glargine or lantus lasts up to 24 hours. So it covers insulin requirement for full whole day. So today we learned about types of insulin, and thanks for watching my video.